Today we'll be talking about type 1 diabetes and an auto-injector pen. Type 1 diabetes is where the body cannot make insulin, so sugar builds up in the blood instead of being used for energy. Type 1 diabetes, you would need lifelong insulin therapy to stay healthy. So with type 1 diabetes, you want to know the signs and symptoms of hyper and hypoglycemia. And that's where hyper is where your blood sugar is elevated and hypo is where it is decreased. So for hyperglycemia, we want to monitor for signs of increased urination, excessive thirst, increased hunger, fatigue, blurred vision, and a fruity breath. For hypoglycemia, we're going to watch out for sweating, shaking, irritability, headache. And for hypoglycemia, we want to make sure we have drinks like juice and hard candies with us. For hyperglycemia, our treatment would be insulin. Also with type 1, we want to know sick day rules. And for that, you want to talk to your healthcare provider about adjusting your dosage. Check your blood sugar every 2 to 4 hours. Check ketones in your urine and stay hydrated. And I would try to eat little meals that contain carbs. Today we'll be going over an auto-injector insulin pen. So what you would need is the pen, needles, and alcohol swabs. So for the pen, you have a dial on the side. You will turn the dial to whatever your prescribed dosage is. And then you will open the needle container and screw the pen onto the needle. So we're just going to put this to the side just for a second and talk about the sites. So on the sites, you have the back of the arm. You would go to the fatty part of the arm and cleanse it. Then you would pinch up and it would go to 90-degree angle, which I will show in just a second. And then you have the belly button. You would go to your belly button and go 2 inches away, clean the side again and go to a 90-degree angle. So now on to injecting the pen into the site. I would recommend that every time you do an injection, you switch the sites. So I would go from one side of the stomach to the arm and the other side of the stomach to the other arm. So now for the pen, I would recommend using an alcohol swab and cleaning the site in a circular motion and letting that dry completely. Then while that's drying, you want to prime the pen to your prescribed dose. I'm going to do 4. You would take the cap off and hold it to the side. And then you would go to a 90-degree angle into the skin and push the pen until the clicking stops. And then hold it for just a couple of seconds. And then let it out. You're going to put the lid back on the pen, unscrew it, and then dispose this into a sharps container.
Today we're going to be talking about the diet for type 1 diabetes. The American Diabetes Association recommends using the diabetic plate. So that would be filling half of your plate with non-starchy vegetables. Those would be asparagus, broccoli, cauliflower, Brussels sprouts, cabbage, celery, and cucumber. You want to fill another 1/4 of your plate with lean protein foods such as fish, chicken, lean beef, soy foods, and cheese. And then you want to fill the other 1/4 of your plate with carbs. Foods that are higher in carbs include whole grains, starchy vegetables, beans, fruit, yogurt, and milk. These foods have the largest effect on your blood glucose, so you want to make sure you're limiting that to 1/4 of your plate. And then you also would want to choose water to drink. You could choose drinks that are lower in calorie or diet sodas, but water is your best option. And then you also want to make sure you're eating snacks in between physical activity, and if you get sick, you want to make sure you're eating more.